Our topic is traumatic brain injury.
A traumatic brain injury is a brain injury that is caused by an outside force. This can be due to a forceful bump, blow, or jolt to the head and body of an object entering the brain. There are different types of a traumatic brain injury. There is the penetrating traumatic brain injury, also known as an open TBI. This occurs when an object pierces the skull and breaks into the brain. This damages only a part of the brain. The next type of TBI is a non-penetrating TBI, which is also known as a closed head injury or a blunt TBI. This occurs by an outside force that is strong enough to move the brain within the skull. Accidents like falls, motor vehicle crashes, sports injuries, blast injuries, or being hit by an object can cause this type of injury. So to begin, our patient history is Cole Anderson. He currently is a machine operator and he is 40 years old. He is currently also living with his spouse. The cause of his injury was a car crash, and he presents with fatigue, confusion, and mood swings. A little behind our patient, Mr. Anderson was on his way home from work when another individual ran through a red light and rear-ended him. This caused his head to hit the steering wheel, which resulted in Mr. Anderson getting a diffused brain injury. Even after Mr. Anderson attends rehabilitation, there are several long-term effects caused from this traumatic brain injury, including cognitive, emotional, and behavioral changes. According to the CDC, individuals with a traumatic brain injury have a 50% increase of decline with activities of daily living due to this type of injury. This type of injury can also increase an individual's chance of dying from things like pneumonia, drug poisoning, seizures, and infections. Individuals with a history of traumatic brain injuries should be considered by professionals for a chronic diagnosis. These type of injuries should be seen as a chronic condition, and therefore professionals should be creating more changes in the healthcare system to help individuals with a lifelong injury. There should also be more community programs and rehabilitation services that focuses on lifelong treatment and resources for these individuals so the risk of an earlier death can be decreased.
The anatomical structures of the brain from a TBI can become greatly impacted. No TBI is the same, therefore, structures affected vary from patient to patient. A study regarding brain injury predictability within anatomical components in relation to a rear end collision accident indicated that the repercussion would end up causing frontal impact to the brain. The brain structure before and after effect can be visualized through the picture above, listed as D, as the red indicates high axonal strain. This can result in sagittal sections of the cerebrospinal fluid, CSF, to shift about 10 millimeters from the medial to lateral sections. Based on Cole's symptoms of fatigue, confusion, and mood swings, three anatomical structures that would be greatly impacted involve the cerebral cortex is composed of gray matter. In particular, the frontal lobe would be impacted from the head hitting the steering wheel. Damage to the structure results in dysregulation in emotion, behaviors, judgment, and thought process. The corpus callosum is a core nerve fiber structure as it connects both sides of the brain together. Damage to this structure results in inability for both hemispheres to communicate with one another, which can result in impairment of cognition and working memory. Further, the basal ganglia is in control of motor control. Damage to this structure results in cognitive fatigue.
Moving on to the physiology portion of the traumatic brain injury. As we mentioned before, this is a diffuse injury. This occurs with a quick acceleration, causing nerve fibers to tear. When Mr. Anderson's head hit the steering wheel, those fibers tore. The symptoms of this type of injury include loss of consciousness, cognitive impairments, motor function problems, and emotional and behavioral changes. This type of injury can also cause hemorrhages and brain edema. Head trauma causes hemorrhages, which then lead to swelling in the brain, known as a cerebral edema. Other sorts of things can happen as well. Excitotoxicity, the occurrence of excessive release of excitatory neurotransmitters like glutamate and aspartate from presynaptic nerve terminals. When this occurs, it can lead to post-traumatic oxidative stress and over time cell death, which can lead to an increase in mortality rate. Apoptotic cell death. This alters the effects of this process, which helps get rid of unhealthy cells in the body. With a TBI, this process cannot function properly, and therefore those unhealthy cells stay within the body. Inhibition of axonal regeneration can also occur. This leads to a slower process of regeneration of brain cells and a decrease in connections of neurons. This can also lead to long-term cognitive deficits. Neuroinflammation also occurs. This is when the immune system does not function properly, which can impact healthy cells in the brain. When healthy cells are damaged, pathogens can enter the body more consistently, which impacts an individual's physical health. Chronic neuroinflammation can cause changes in emotional processes like thinking and concentration, behavioral changes, fatigue, decrease in motivation, as well as cognitive changes.
Now for the diagnosis. When a TBI is suspected, clinicians use several tools to assess severity and guide treatment. The Glasgow Coma Scale evaluates a patient's eye opening, verbal response, and motor response to determine their level of consciousness. A CT scan is typically the first imaging choice in emergency settings because it quickly identifies bleeding, clots, and fractures. Importantly, blood biomarkers are now being used to detect brain injury even when imaging looks normal, which is especially valuable in mild TBI cases. Finally, we have to consider modifiers like age, mental health history, and social support because these factors significantly influence how well someone recovers. Medical treatment for TBI varies significantly depending on severity. For mild TBI, the approach is largely conservative: rest, over-the-counter pain relievers, symptom monitoring, and a gradual return to daily activity. Most people recover well with this approach if given adequate time. For moderate to severe TBI, the priority shifts to managing intracranial pressure, ensuring proper oxygenation, and preventing seizures, which are a common complication. Medications like diuretics help reduce brain swelling, anti-seizure drugs protect against further neurological damage, and sedatives may be used to allow the brain to rest. In the most serious cases, surgery becomes necessary, whether that's removing a blood clot or repairing a skull fracture. Understanding this spectrum of treatment helps us as OT practitioners know where our clients are in their recovery and how we can best support their return to meaningful occupations. As for impact to occupation, TBI doesn't just affect the brain, it affects every area of a person's daily life and work. For someone like Cole, cognitive, physical, and emotional changes can make it difficult to perform job tasks effectively. Mood swings and communication difficulties can strain relationships with coworkers. If Cole works as a machine operator, fatigue and confusion become serious safety concerns. Research shows that 17% of mild TBI patients haven't returned to work within 12 months of their injury. Beyond employment, TBI can also impact ADLs and IADLs, the everyday tasks we often take for granted, which is exactly where occupational therapy plays a critical role.
The shift in changes to occupations with disease progression could cause functional changes which can occur later after TBI, resulting in potential changes to an individual's characteristics and ability to participate in meaningful occupations. Cole's identity as a working husband is at a crossroads, as he is not able to help contribute to his role as a provider in the family, and if stagnant or regressive in progression, could result in disability. These changes can significantly disrupt performance patterns and Cole's ability to participate in work, leisure, and self-care through performance skills pertaining to his motor, vestibular, and visual impairments, psychosocial, behavioral, and emotional skills, as well as cognitive functioning. The ultimate goal is to help Cole with managing symptoms on his own. Cole will be unable to drive, therefore his community mobility is reliant on his spouse. Once he is able to return to work within a few months to over a year's time, it adds on the layer of advocating for what he needs, whether it's more breaks to prevent further regression. Therefore, gradual re-engagement in Cole's occupations will need to be facilitated through how to best grade up or down given his cognitive load of the day.
For potential adaptive equipment, there are several options that can help the client better navigate their environments. This can include the use of shower chairs, grab bars, and wheelchair ramps. Assistive devices can provide the client with a sense of independence while ensuring safety when completing occupations such as activities of daily living. These devices can help with the client's fatigue symptoms as they help provide stability, reduce the risk of falls, and conserve energy. Fatigue causes limited energy levels, so it is important to find ways to conserve it. Regarding occupational therapy intervention strategies, there are several different approaches that can be taken. This includes cognitive rehabilitation, which works to target intervention for memory training, processing information, problem-solving activities, and decision-making skills. These interventions also target concentration and attention to improve overall outcomes. Another option is sensory integration. This helps with regulation and sensitivities of sounds, light, and touch without sensory overload. This intervention targets ways to improve focus, engagement, and promotes appropriate responses. Next is vocational rehabilitation. This involves creating a plan to develop skills needed for work, such as assistance with training for jobs and finding opportunities, along with gaining access to workplace accommodations. Next is activities of daily living training. This would be regarding dressing, eating, and bathing. These activities can be difficult after a traumatic brain injury, and interventions aim to focus on independence in motor, physical, and cognitive skills. Next, for instrumental activities of daily living training, this would be regarding the areas of financial management, meal preparation, housekeeping, and medical management. For home modifications, this can be done through environmental changes within the home, such as adjustment in counter heights and furniture arrangement. Lastly, for leisure skills, this encourages the individual to find new hobbies or re-engage in previous activities that were meaningful to the client. And here are our references.